Well, Intermountain Healthcare is one of our sponsors, and we are talking to nurse practitioner Rachel Decker right now. And this is a common problem. Rachel is with the TOSH Back and Neck Center, and we're talking back and neck pain.
Right.
All right, thanks for coming in.
Thank you for
Is
having
there
me.
a person out there that hasn't had back pain? Right? It's almost like not if but when, right?
That's true. Over 80% of the population does have an episode of back pain at some point during their lives.
All right, so back pain is a pretty widespread term.
It is.
So when we're talking back pain, what are the things that we need to know?
The specific cause of back pain is oftentimes unknown, and sometimes it really doesn't even matter. There's so many different causes of back pain. What I think the population needs to know is when they need to worry about their back pain.
Right. I mean, is it, you talk about back pain lasting longer than 3 weeks, is that right?
Sure. If back pain is lasting longer than a couple of weeks and just not getting better, that would be a good reason to go and see your healthcare provider about your back pain.
But I've had back pain since my mid-20s.
Yes.
You probably hear that all the time.
I do.
But I can usually, take care of mine with yoga or some stretching. Is it when it becomes like it's interfering with your daily life that it becomes a real problem?
Exactly. So the things that you would normally do to cure your back pain on your own are no longer working, or if it's getting worse, or if you start to develop new symptoms like a pain that's coming down your leg and doesn't go away, those would be more serious reasons to see your doctor.
Yeah, what are some of the most common misconceptions you hear about back pain?
Yeah, there's a lot of misconceptions about back pain. A lot of people come into the clinic and they want to know the exact cause of their back pain.
Oh, because we want answers.
Exactly, because the thought would be, well, if you know the cause, then you know the cure.
Right.
And that's just not the case with back pain.
And that can be really frustrating for people, I'm sure.
It is very frustrating for people. If we were to go around and do MRIs on everybody in the population, almost everybody would have something wrong with their back, whether they have back pain or not.
Right.
And so knowing the exact cause doesn't necessarily help us cure the cause.
Okay, but at the TOSH Back and Neck Center,
yes,
you guys are well equipped with state-of-the-art equipment and doctors and nurses to help diagnose what exactly is going on.
That's correct. At the TOSH Back and Neck Center, we like to get people in within just a day or two of them calling in, and they would see myself as well as a physical therapist. And we really rule out the more serious conditions, and then in most cases, we give simple recommendations on how to handle their back pain.
Right.
So things like ice and heat and finding a comfortable position, simple over-the-counter pain medications or prescription medications.
Yeah, I know my husband, he had a serious injury years ago, and he's always been told, oh, it's not if but when you'll have back surgery. And I'm sure that you end up saying that to a lot of people, right? Yeah,
sometimes that is the case, but not all back pain requires surgery.
Right.
And sometimes people never get to the point where it requires surgery. So I would recommend people to stay active, to keep their weight down, and doing those simple measures could perhaps prevent surgery someday.
Right, but you say that you see a lot of thin people who are in their target weight who also have back pain, which shows that a lot of it is genetic.
Absolutely.
Okay. All right, so the TOSH Back and Neck Center is where?
It's at TOSH in Murray in the medical tower. Our phone number is 801-314-2210. And like I said, if you call the clinic, we'll get you in within just a couple of days of your call, and we'd be happy to see you and give recommendations on how to handle your back pain.
Okay, very good. Thank you so much for coming in.
Thank you for having me.